F and E kidney.
Upon Sam's admission for acute psychiatric hospitalization, Nurse Jonah documents the following. Client refuses to bathe or dress, remains in the room most of the day, speaks infrequently to peers or staff. Which nursing diagnosis would be the priority at this time? These behaviors indicate the client's withdrawal from others and possible fear or mistrust of relationships. If a client is found to be very paranoid, solitary or one-on-one activities that require concentration are appropriate. The client is free to choose his level of interaction. However, concentration can help minimize distressing paranoid thoughts or voices. If a client is unable to respond verbally or in a coherent manner, spend a frequent, short period with clients. An interested presence can provide a sense of being worthwhile. Question: which statement is correct about a 25-year-old client with newly diagnosed schizophrenia? Age of onset is typical for schizophrenia. The primary age of onset for schizophrenia is late adolescence through young adulthood, ages 17 to 27. Paranoid schizophrenia may sometimes have a later onset. The incidence is also up to 10 times greater in children of African and Caribbean migrants compared to Caucasians, according to a study conducted in Britain. All of the other options are incorrect. Question: which factor is associated with increased risk for schizophrenia? D. Poverty. Low socioeconomic status or poverty is an identified environmental factor associated with an increased incidence of schizophrenia. A criticism of this research field, which is in fact a criticism relevant to much social science research, is that the investigation of socio environmental factors in the environment invariably focuses on poverty and deprivation to the exclusion of other important variables. One such variable is income inequality. Income inequality is a measure of the rich-poor gap in any given society, and therefore it exists at the ecological level. Nurse Arya assesses for evidence of positive symptoms of schizophrenia in a newly admitted client. Which of the following symptoms are considered positive evidence? Select all that apply. B. Delusions. D. Hallucinations. E. Loose associations. These are considered positive symptoms of schizophrenia. The typical positive symptoms of schizophrenia, such as hallucinatory experiences or fixed delusional beliefs, tend to be very upsetting and disruptive. Not a positive experience at all for you or someone you care about who is experiencing them. From the outside, a person with positive symptoms might seem distracted, as if they are listening to something. Psychiatrists call this responding to internal stimuli. The phrase positive symptoms refers to symptoms that are in excess or added to normal mental functioning. A client with schizophrenia is referred for psychosocial rehabilitation. Which of the following are typical of this type of program? Select all that apply. B. Developing social skills and supports. C. Learning how to live independently in a community. D. Learning job skills for employment. E. Treating family members affected by the ill. The goal of psychosocial rehabilitation as a treatment method is to help the client develop the skills and supports necessary for successful living, learning, and working in the community. Analysis of family issues and past problems and treatment of family members are not commonly part of this type of program. The emphasis of psychosocial rehabilitation is on the client's development of skills in the here and now. Consequently, psychoanalytic counseling is not part of the approach. The nurse is caring for a client with schizophrenia. Which of the following outcomes is the least desirable? A. The client spends more time by himself. The client with schizophrenia is commonly socially isolated and withdrawn. Therefore, having the client spend more time by himself wouldn't be a desirable outcome. Rather, a desirable outcome would specify that the client spends more time with other clients and staff on the unit. Delusions are false personal beliefs. Eventually engage other clients and significant others in social interactions and activities with the client, card games, ping pong, sing-songs, group sharing activities at the client's level. Client continues to feel safe and competent in a graduated hierarchy of interactions. The nurse formulates a nursing diagnosis of impaired verbal communication for a client with schizotypal personality disorder. Based on this nursing diagnosis, which nursing intervention is most appropriate? Establishing a one-on-one relationship with the client. By establishing a one-on-one relationship, the nurse helps the client learn how to interact with people in new situations. Assess if incoherence in speech is chronic or if it is more sudden, as in an exacerbation of symptoms. Establishing a baseline facilitates the establishment of realistic goals, the foundation for planning effective care. Since admission 4 days ago, a client has refused to take a shower, stating, "There are poison crystals hidden in the shower head. They'll kill me if I take a shower." Which nursing action is most appropriate? D. Accepting these fears and allowing the client to take a sponge bath. By acknowledging the client's fears, the nurse can arrange to meet the client's hygiene needs in another way. Attempt to understand the significance of these beliefs to the client at the time of their presentation. Important clues to underlying fears and issues can be found in the client's seemingly illogical fantasies. Recognize the client's delusions as the client's perception of the environment. Recognizing the client's perception can help you understand the feelings he or she is experiencing. Drug therapy with thiazidine, Milarel, shouldn't exceed a daily dose of 800 mg to prevent which adverse reaction? D. Retinal pigmentation. Retinal pigmentation may occur if the thiazidine dosage exceeds 800 mg per day. The development of pigmentary retinopathy is a unique adverse manifestation associated with thiazidine, and not with other antipsychotics. Patients may have nonspecific symptoms while taking thiazidine, such as dry mouth, dry eyes, sedation, weight gain, dizziness, erectile dysfunction, pruritus, photosensitivity, and constipation. Other rare and more unique side effects of thiazidine include irreversible retinal pigmentation, poikilothermia, and agranulocytosis. A client with paranoid personality disorder is admitted to a psychiatric facility, which remark by the nurse would best establish rapport and encourage the client to confide in the nurse? A. I get upset once in a while, too. Sharing a benign, non-threatening, personal fact or feeling helps the nurse establish rapport and encourages the client to confide in the nurse. The nurse can't know how the client feels. Identify with the client's symptoms he experiences when he or she begins to feel anxious around others. Increased anxiety can intensify agitation, aggressiveness, and suspiciousness. If a client is found to be very paranoid, solitary or one-on-one activities that require concentration are appropriate. The client is free to choose his level of interaction. However, concentration can help minimize distressing paranoid thoughts or voices.